Hello and welcome back to COVID-19 updates. In today's video, I'm going to be talking about the UK epidemic growing as the R number goes above 1. Public health officials have warned of worrying signs of infection among the elderly as a new official measure indicated the UK's epidemic is growing again. The R number was raised between 1 and 1.2 for the first time since March. Any number above 1 indicates the number of infections is increasing. The number of new daily coronavirus UK cases of the virus rose to 3,539 on Friday, an increase of more than 600 on the previous day. The virus is still at much lower levels across the UK than at the peak in April, but a study of thousands of people in England found cases doubling every 7 to 8 days. It found a marked rise in infections in the north and among young people. Yvonne Doyle, the medical director at Public Health England, said although younger people made up the greater share of new cases, we are now starting to see worrying signs of infections occurring in the elderly, who are at far higher risk of getting seriously ill. A PHE reports that there have been a particularly steep increase in positive results in the over 85s and in the northwest of England, a rise in people from that age group being admitted to hospital. However, though cases are rising, the number of patients in hospital remains largely flat at 863. Of those, 78 are on ventilators, according to latest government figures. Ms. Doyle warned people to follow social distancing rules, wash their hands regularly, and wear a face covering in enclosed spaces. Ms. Doyle warned people to follow social distancing rules, wash their hands regularly, and wear a face covering in enclosed spaces. Meanwhile, Birmingham will become the latest area to bring in new restrictions after a spike in cases. Tougher restrictions now cover more than 1.75 million people in the west of Scotland, and from Monday, million people, from Monday, face masks must be worn in shops in Wales. However, lockdown restrictions will be eased further in Leicester on Tuesday to bring rules for businesses in the city more in line with the majority of England, the Department of Health said. The city has been subject to tighter COVID-19 restrictions since the 29th of June after a rise in cases. Across the UK, new laws of how many people can socialise are being introduced from Monday in an attempt to hold back the rise in infections. The rule of 6 will restrict indoor and outdoor gatherings in England, Scotland, Wales and Northern Ireland. One thing that I don't get about the rule of 6, if you think about it, they're saying that most of the cases increase is actually from the younger generation who have obviously just been off for the summer. But all of those people are now going back to schools, workplaces and universities, and the rule of 6 doesn't occur there. So I think it's quite counterintuitive, to be honest. But anyway, police warned that there was a real risk some people would treat this weekend as a party weekend before the new restrictions come in. John Apter, the national chairman of the Police Federation of England and Wales, said that would be incredibly irresponsible at a time of increasing cases, and officers would make no apology for fining people where appropriate. The rise in the R, the reproduction number, which describes how many others each infected person passes the virus onto, is one of the several measures indicating the virus is spreading more widely in the UK. If the R number is higher than 1, as now, the numbers infected are growing, with higher numbers indicated that cases are multiplying more quickly. 3 other large studies have also indicated a widespread resurgence of coronavirus across the UK population. The UK government is entering a new stage of the coronavirus pandemic. Since lockdown, we have been deciding how to react to falling cases, but now the R number has gone above the crucial level of 1 for the first time since March, and is backed up by reams of data showing cases are growing again. This is not just to hotspots like Bolton, one government advisor told me. The rise was widespread across the country. They said today was a wake-up call for the nation. There are already some signs that the number of people being admitted to hospital is starting to rise. But this is not a repeat of the build-up to lockdown. Cases are at a much lower level and they are growing more slowly. Pre-lockdown, the R rating was around 3 and cases were doubling every 3 to 4 days. It is around half that now. Coronavirus is going to be a major challenge until we have a vaccine, so the defining question as we head into a potentially difficult winter is how to keep balance, keeping the virus in check with getting on with our own lives. So these are the R rating estimates in the nations and regions with the ranging COVID-19 reproduction numbers. So I'm just going to go through each country. So England has got an estimate of 1.2, between 1 and 1.2. Scotland's got an estimate between 1.1 and 1.5. So basically, the higher the reproduction rate, the worse it is, because for each person that has it, that's how many they pass on to at least, basically on average. Wales has got an R number between 0.5 and 1, so that means it's actually going down. Northern Ireland, oh, that is a very wide spread. It's between 0.3 and 1.4, so it could be spreading, it could not be spreading. That's quite crazy. In London, it's between 1.1 and 1.3. The Midlands between 0.9 and 1.1. Northeast and Yorks, it is between 1 and 1.2. The Northwest is between 1.1 and 1.3. And the Southeast is between 1 and 1.2. The Southwest is between 1 and 1.2. 0.9 and 1.2. The REACT study of more than 150,000 volunteers in England, one of the 3 new sources of data on community levels, found increasing transmission at the end of August and start of September. It said levels of infections were rising across England, but particularly in the northeast, northwest, and Yorkshire, and there was an increase in positive cases in all age groups up to the age of 65, with highest rates of growth in 18 to 24-year-olds. Professor Paul Elliott, the Director of Study at the Imperial College London, said that the data clearly showed a concerning trend in coronavirus infections, where cases are growing quickly across England and are no longer concentrated in key workers. He said there was evidence of an epidemic in the community, which was not the result of more people being tested. So young people have seen the biggest rise in cases in recent weeks. So there's a prevalence by age group with a range of confidence. The second set of data from the Office for National Statistics, the ONS, estimates there were 36,700 new cases of the virus in England during the first week in September, 11,000 more than the previous week. The ONS bases its figures on thousands of swab tests carried out in households, whether people have symptoms or not. It estimated no increase in cases for the same week in Wales, but First Minister Mark Drakeford has announced people will now wear face masks in shops in response to rising case numbers in recent days. Catherine Kent from the ONS Infection Survey said the results suggested an increase in COVID-19 infections in England during recent weeks, with higher infection rates among 17 to 34-year-olds. I'm just looking at a chart of the daily hospital admissions. There's actually a lot less of people in hospital, even though there are an increase in cases. My auntie showed me a thing today. Basically, if you look at the graph, there's basically, although there are an increase in cases, first of all, there were probably a lot more people that had it initially, but weren't being tested. It went around March and April. But actually, although there are an increase in cases, there aren't that many deaths whatsoever. I'm pretty sure the other day there was 2 deaths. And if you look at that across the whole country, it's basically nothing. So, carrying on, Nicola Sturgeon has warned that the average number of cases in Scotland has been more than trebling every 3 weeks, with some areas of particular concern include Lanarkshire, Greater Glasgow and Clyde. And the third set of figures from the COVID Symptoms Study app, which tracks the health of nearly 4 million people in the UK, also suggests a growth in new cases since the end of August. The first time since mid-June, there has been a significant rise in numbers. Professor James Naismith from the University of Oxford said younger people would also have been affected to the same extent in January if testing had been available. We know that medical treatment and scientific advances have improved significantly. Thus, even with infection rates as bad as March and April, there will be many fewer deaths. The more people that wash their hands and practice social distancing, especially by and around those who are vulnerable, the lower the number of deaths and illnesses we will see, he said. So that's it. I hope you found this very interesting. I found it very interesting for myself. If so, please do leave a like and consider subscribing. But yeah, the whole thing's absolutely crazy at the moment. Please stay tuned for my other videos. I've got something about something that's just happened about the school. Obviously, the schools are starting up, and I've got a very interesting story to tell you about that. So please do watch out for my next videos. Thank you very much, and stay safe, stay well, and hopefully I'll see you guys sometime in the future. Thanks.